I'm Matt McKinley here representing TF76, and I'd like to talk to you a little bit about radiation exposure, how to recognize some of the signs and symptoms. If you were within 3 miles of the detonation site or were within the fallout zone, you may have received a dose of radiation that could require medical attention. If you were exposed to fallout and you developed skin burns shortly after, what you need to do is remove your outer layer of clothing carefully, place the clothes in a garbage bag that can be sealed, and then seal the bag up. If you can, take a warm shower, not a hot shower. Use mild soap and shampoo, don't use conditioner, and then put on a clean pair of clothes. After you've done that, you should seek medical attention because you may have received a skin dose of radiation that needs medical treatment. If you were within 3 miles of the detonation site and had a prolonged exposure to the fallout or a short duration exposure to the fallout in the early days after the detonation, you may also have received a very dangerous dose of radiation. Some of the symptoms of acute radiation syndrome include nausea and vomiting. If you experienced either of those symptoms shortly after your exposure to radiation, then you definitely need to seek medical attention. There is help that can be provided. If you also experienced flu-like symptoms like nausea, headache, fever, diarrhea, this may also be an indication of a dangerous exposure to radiation. If you have these symptoms and were in these areas, seek medical attention. If you were not in these areas, if you were outside of the 3 miles radius of the detonation site, or were not in the fallout zone, or were in the fallout zone but followed shelter-in-place instructions and did not leave your shelter until you were instructed to evacuate, it's very unlikely that you would have been exposed to dangerous levels of radiation. Please understand that the healthcare providers throughout the region are working well beyond capacity, helping those with acute injuries and life-threatening illness. If you don't believe that you are likely to have received a dangerous dose of radiation and you have not experienced skin burns, please be aware that your presence at a healthcare facility could overtax an already overburdened healthcare system. And we would ask that if you please try to refrain from seeking medical care at this time.